what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rockets' red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Good afternoon. I want to extend a warm welcome to the family and friends of those graduating today, to the College of Public Health faculty and staff, and especially to the students whose hard work and achievements we celebrate today. I'm Christine Arcari, Associate Dean for Academic and Student Affairs in the College of Public Health. Thank you for joining us on this special day. It's my pleasure to introduce Dr. Ali Khan, Dean of the College of Public Health, to say a few words.
Welcome, esteemed faculty, staff, students, family, friends, and especially our graduates, to the 2020 Public Health Convocation and Commencement. Even in the time of COVID, we will honor some traditions that recognize the solemn nature of this ceremony and formally recognize the tremendous achievements of our graduates. Let me start, however, by acknowledging the people who made this day happen, the parents and partners of our graduates, their family and friends, and of course, our faculty and staff. No student is an island, and while they did put in long hours to earn their degrees, it was standing on the shoulders of giants and with the support of their loved ones. Now let me briefly address our graduates. Trust me, it'll be brief because unlike a live ceremony, I know you can fast forward through my remarks. 2,300 years ago, Hippocrates said, there are in fact two things, science and ignorance. The former begets knowledge and the later ignorance. As graduates, this is your grand challenge. How do you advance knowledge for the health of our communities and address the great inequities of our times, here in the United States and worldwide? And how do you stand for your principles when faced with misinformation, disinformation, and even threats? Public health is still a humbling career to be in, partly because, for the most part, when we do it right, public health is invisible, right? Yet every now and again, a natural disaster or a plague exposes the role of public health practitioners for the world to see, and COVID's achieved just that. And my condolences to you for those of you who have lost friends and family from this preventable plague. With terrifying clarity, COVID has exposed something that you have understood for a very long time. The foundation of public health, collective action to protect the health and promote health of all of society, is social justice. However, continued social injustices in our society have an impact on all of us. During this pandemic, we have seen that a disproportionate number of cases and deaths have been amongst Blacks, Indigenous, and people of color. Every one of us shares the burden of that risk. Through masking, social distancing, and hand washing, we have been reminded of our common humanity. So let's harness the power of that to create a better society. Graduates, today you become public health practitioners at a time when your contributions to the various fields of health promotion, epidemiology, maternal and child health, environmental and occupational health, health services research, biostatistics, and many others that you have learned over the course of the last 2 to 4 years will be visible and celebrated. But when the crisis is over and the world goes back to a feeling of calm, and trust me, as an infectious disease expert, this too will pass, the work you are doing in your different fields will continue to be just as important in the future as it is today. Whether that work happens to be in academia, research, federal agencies, the public-private sector, nonprofits, healthcare systems, whether it's in this beautiful country or whether it's anywhere in the world, please remember this pandemic. The world needs you. Remember how important your training and skills are for the world. Remember what happens when something goes wrong and public health becomes visible. Remember the impact you have on families, on communities, on healthcare systems, and on individuals when public health is exposed, and especially when it is not. Remember that the work of public health is about births, deaths, and disease denied. Clean and safe water, air, and food, safe neighborhoods to live, work, learn, and play in, where you can go for a walk without fear and find healthy food. Vaccines, smoke-free cities, farmers protected from hearing loss and rollovers, healthy and thriving oceans, forests, and wildlife. This is all essentially the stuff of life, what binds us together as individuals into families and into societies. That's your new remit, life. Thank you for your effort, for your passion, and the work you have done and will continue to do. In my book, that makes you braver and stronger than any screen superhero. Now I have the honor to introduce our guest speaker, Dr. Michelle Beaver. Dr. Michelle Beaver is the Executive Director for the South Heartland District Health Department. She earned her PhD in Anatomy and Neurosciences from Purdue University in 1990, then followed a teaching and research pathway for 13 years. In 2003, she moved to her new home in the state of Nebraska due to a spouse career change and started to look for her own new career. Fortunate for us, what began as a part-time diversion into the field of public health at a brand new 4-county South Heartland Health District blossomed quickly into a full-time public health risk coordinator position, which included responsibilities of launching the new department's preparedness and disease surveillance programs. As this diversion of hers became a passion, she entered the Distance MPH program at Rollins School of Public Health at Emory University in Atlanta. After that, she took over as South Heartland's executive director in 2007. Dr. Beaver serves as an adjunct professor here at the college in the Department of Health Services Research and Administration. She also serves on numerous boards, including as vice chair of the Mary Landing Healthcare Board of Trustees and as immediate past president of the Nebraska Association of Local Health Directors. She counts amongst her proudest accomplishments leading South Heartland through the public health accreditation process as one of the smaller departments in the nation to achieve this status. The department was notified of this success by FAB in March of 2020 in the midst of the first wave of the COVID pandemic. Dr. Beaver says navigating the local communities and the health department through this pandemic is the most challenging task she has ever undertaken. Please join me in welcoming Dr. Michelle Beaver, and remember, mask on.
It's an honor to be included in this event and to join College of Public Health faculty and dignitaries in recognizing your accomplishment. I came to public health later in my career, and now I'm all in. My experiences serving in public health have to be some of the most challenging and at the same time, most satisfying of my life. Whatever drew you to public health, I'm glad you're here. We need you. Last year at this time, I would venture to say that most of the public in our 4-county health district could not have named their local public health department and probably didn't have any idea what we do or what we're responsible for. South Heartland even includes goals in our strategic plan to increase name recognition and awareness of public health in our department. Sure, we've built great partnerships with many community, healthcare, governmental, and nonprofit organizations. But at the end of every year, I would scan the highlights of this past year that showed up in the local newspaper in those weeks leading up to New Year's Eve and wonder, how can local public health be more visible? Last year at this time, our department was just 2 weeks past submitting our accreditation action plan documentation to FAB, the Public Health Accreditation Board. The accreditation process helped us to demonstrate how we are meeting standards for each of the essential public health services. We were relieved at that time to have reached the milestone of submitting that action plan. And we were hopeful that we would learn in a few months that our tiny department had achieved the status of an accredited local health department. And last year at this time, the coronavirus pandemic was already brewing in China, but not really on our radar yet. We could list pandemic planning and response in our cadre of skill sets. We had a pandemic plan chapter in our emergency response plan, had plenty of experience leading extensive community planning in the early 2000s for a potential avian flu pandemic, and we had been through the H1N1 influenza pandemic in 2009 and 10. And last year at this time, it would be less than a month until we would be activating these plans, launching into a response that was more extensive, more sustained, more taxing than anything that we had imagined or planned for. Looking back from where we stand now, still in the midst of this unprecedented global pandemic, we can see that the responses required we draw upon every essential public health service, the essential services we had just completed demonstrating to FAB as part of the accreditation process. As a quick sidebar, the 10 essential public health services describe the public health activities that all communities should undertake, and they serve as our framework for carrying out the mission of public health. As you probably know, a revision to this 25-year-old framework was released this past September to bring our framework in line with current and future public health practice. So, as I walk through some selected highlights of our local public health response to the SARS-CoV-2 COVID-19 pandemic, I hope you'll notice the essential public health services in our pandemic response. Our health department began preparing for a COVID-19 outbreak in mid-January and stood up the Public Health Coordination Center on January 29th. Our surveillance staff were monitoring the activity in China, watching the number of cases double each week, aware and preparing as the cases spread to the United States. The first confirmed case of COVID-19 was detected in the state of Washington on January 21st. International travel was still occurring. Our department worked closely with a local college as they prepared for groups of students to travel abroad and return safely with COVID return plans that included the potential for immediate quarantine upon arrival home. Our district's first local case of COVID-19 was reported on March 18th and was a member of the travel team. However, there were no further spread due to the college's thorough planning and detailed implementation. As more cases appeared locally, the pandemic began to consume our activities. Early on, surveillance staff took calls at all hours from hospital emergency departments and healthcare providers to answer questions and facilitate testing for patients who had symptoms that might be consistent with COVID-19. Other staff began to be redirected from their usual duties to train up for and implement response roles like supplies management and distribution, including PPE, active case monitoring, case and contact investigations, providing quarantine and isolation letters, reviewing event safety plans, developing public education and materials that were language appropriate and health literate, expanding website capabilities and data management, and responding to the huge call volume. We expanded staff hours and everyone worked overtime. We added capacity by recruiting volunteers and hiring and contracting others. We increased from 12 people pre-COVID to more than 20 currently. All of these people needed some basic public health training and some specific COVID-related training. We implemented worksite prevention practices at the office and beefed up technological capabilities and policies for working remotely. We also monitor best practices and guidance from CDC, Nebraska Department of Health and Human Services, professional associations, and other sources, and shared current information to assure our team, partners, and stakeholders are applying the most up-to-date practices and materials. The team has also worked closely with industry and business, long-term care facilities, and healthcare facilities, coordinating with UNMC specialized response teams to address outbreaks in these settings by arranging for testing and encouraging implementation of prevention measures to reduce the spread in these sites. Availability of testing really has changed a lot over the course of the pandemic. At the beginning, testing was highly restricted, so only those with severe symptoms could be tested, and it needed to be approved by local public health, and it could only be processed through the Nebraska Public Health Lab. As more testing supplies and platforms became available, and more commercial labs were able to process the supplies, The restrictions on who could be tested were gradually lifted. Now, between the state contracted Test Nebraska project for free testing and the influx of various types of testing offered at healthcare providers' offices, the testing is much more widely available, which is very important for identifying positive cases and implementing isolation and quarantine to limit spread. We began tracking COVID-19 indicators such as new, daily, or cumulative cases, as well as symptoms, age, race, ethnicity, occupation, hospitalizations, deaths, the number tested, positive test rates, etc. And we shared trends and summaries on our website at first, and later using our COVID-19 dashboard, which was newly created by a public health student intern. By June 30, our COVID-19 case count was 330, and our staff had connected with 1,617 individuals for investigation and isolation or quarantine placement to help prevent the spread of COVID-19. We created a COVID-19 risk dial to summarize a set of metrics to help the public understand the overall COVID-19 risk in our communities. This went live on our website in early July and continues to be updated weekly. Communication is a huge focus. There's an abundance of virtual meetings, conference calls, briefings, webinars with partners and officials at local, state, and national levels. We developed new or expanded communication distribution lists, and we revised our communications protocols to keep our key partners informed. Depending on the circumstance, we are using web-based alert sense notifications, social media, the web-based data dashboard, news releases, public health columns, in-person and virtual press conferences, billboards, community signboards, advertisements, radio and TV interviews, message on hold information through our phone system, text messages, encrypted emails, a web form question submission process, web-based file sharing, and email and phone correspondence to respond to calls and emails from the public and providers and other partners. Staff worked to create a COVID-19 information page on our website that is user-friendly, easy to navigate, and informative. Our website views went from 476 in February to 26,191 in April. Our department works with law enforcement, county attorneys, emergency management, and city and village governments to provide education, guidance, and enforcement for complying with the state's directed health measures. And we provide information and recommendations to our local municipal officials as they look at local policies and ordinances to improve the safety of their communities during the pandemic. As the state-directed health measure restrictions began to be loosened through the summer, we worked with schools on their COVID-safe summer programs and fall reopening plans. We assisted event planners on planning for COVID-safe events, and we coordinated with other health departments on a process for reviewing and approving event safety plans as required by the directed health measures. At the local, state, national, and global levels, this pandemic, as most emergencies and crises tend to do, exposed planning and implementation gaps and system weak points. This provides us with opportunities to improve and strengthen the public health system. So 11 months since we initiated our response to COVID-19, I would venture to say that a much larger percentage of the public knows who we are and some of what we do. Many express gratefulness, others are angry or question our public health authorities and actions. 11 months since we initiated our response, our 4-county health district is experiencing our second wave of cases and marking a cumulative 3,400 lab-confirmed COVID-19 cases, more than 130 residents who have needed hospital care, and sadly, we have received confirmations for 37 of our health district residents who have died due to complications of COVID-19. In this 11th month of the response, we are entering a new phase. A COVID vaccine is approved and beginning to arrive for administration to the priority groups. And planning for this distribution involves discussions of equity, access, and limited resources. We are adding COVID vaccination on top of the other ongoing pandemic response activities. Response to this pandemic requires individuals with widely divergent skills and expertise able to fulfill all of the public health essential services that support the public health system and to address all of the other pressing public health issues that we hope to eventually return some focus to. We need disease investigators, artists, communicators, policy wonks, statisticians, administrators, community health workers, educators, healthcare and behavioral health professionals, scientists, law enforcers, laboratory gurus, legal experts, planners, information managers, facilitators, translators, just to name a few. This is where you come in. You may already know where you are landing next, or you may be searching for that special niche in corporate, government, healthcare, research, or a public health department or community settings. Wherever you will be contributing to public health, allow me to welcome you to the public health community. We need you, and we are excited to have you join us in our efforts to help everyone be healthier and to help our communities, our nation, and our world to be healthier places for people to live, work, and play. My heartiest congratulations and best wishes to you on this day of your graduation.
Thank you for your wonderful remarks, Dr. Beaver. We're very honored to have you speak on this memorable occasion. Now it's time to recognize our graduates. We will start by recognizing our certificate graduates. Certificates are designed for members of the public health workforce seeking skills and credentials and are designed to improve public health practice and public health workforce capacity. These students have completed 12 to 18 credit hours of graduate coursework to earn their certificate. Fall 2020 graduates. Joseph John Dozal, Public Health. Jessica Georgina Gutierrez, Public Health. Dominique Nicole Holmes, Public Health. Veronica Riva Lee, Public Health. Judith Ngozi Obuduyugo, Public Health. Summer 2020 graduates. Ada V. Luna, Community-Oriented Primary Care. Zhenhan Tong, Public Health. Jiayan Zhang, Public Health. Iya and Shuan Zhu, Public Health. Now, we will recognize the Master of Health Administration and Master of Public Health graduates. These students have completed a minimum of 42 credit hours of coursework. In addition to completing a rigorous academic curriculum, our master's students have also worked in practice settings under the guidance of a preceptor and completed capstone projects with their faculty members to demonstrate the synthesis of competencies they have learned in their programs. Part of the recognition of completing a master's degree is the hooding of the graduate. The hood is a special part of the academic regalia that denotes scholarly and professional achievement. Placing the hood over the head of the graduate signifies their success in completing the program. The velvet color of the hood signifies the degree and discipline, and the satin colors represent the school. The official hood color for the Master of Health Administration is sage green, and the official hood color for public health is salmon pink. The colors scarlet and cream represent the University of Nebraska. Master of Health Administration students, Fall 2020 graduates. Sha Tao, Containment Measures and Leadership Styles Towards COVID-19. Master of Public Health students, Fall 2020 graduates. Decatur Paul Benker, Environmental and Occupational Health, Assessing Occupational Stress and Preparedness among Campus Safety Officers and Dental School Employees at an Academic Medical Center during COVID-19. Sarah M. Cataret, Epidemiology, Effects of Climate Change on the Epidemiology of Flood-Related Waterborne Disease, a Systematic Literature Review. Alyssa Louise Damke, Environmental and Occupational Health, Development of a web-based ag HRA tool for military veteran, farmers, and ranchers. Andrew Fulmer, Environmental and Occupational Health, Germicidal Efficacy, Filtration Efficiency, Structural Integrity, and Fit Testing of N95 Respirator Masks After Sterilization and Decontamination, a Systematic Literature Review. Anthony Johnson Jr., Environmental and Occupational Health, Agricultural Injuries Among Central State Region Operators Over a 5-Year Period, CS Cash Farm and Ranch Hand Health and Injury Survey, 2011 to 2015. Jason Allen Jones, Public Health Practice, Non-Emergency Utilization of EMS, Contributing Factors and Strategies to Promote Effective Care with Appropriate Resources. Cassandra L. Kennedy, Public Health Administration and Policy, Global Budget Payments and Rural Emergency Medical Center Models in Iowa's Rural Hospitals. Shelby A. Larson, Health Promotion, a qualitative analysis of Omaha Healthy Kids Alliance's client educational attainment. Adrian Moody, Public Health Practice, program evaluation of blind and deafblind access to emergency preparedness information about coronavirus disease 2019 on federal, state, and local public health websites. David Michael Moran, Environmental and Occupational Health, lead levels of mercury and cadmium among residents of neighborhoods surrounding a coal-fired power plant in Omaha, Nebraska. Caitlin Marie Nelson, Health Promotion, perceptions of voice health care, and voice health education in the performance community. Jill Renee Oatman, Environmental and Occupational Health, developing a rabies prevention program based on rabies exposure data in Nebraska. Meredith Olson, Epidemiology, effective climate change on Lyme disease cases in 4 New Jersey counties. Chessa Shea Quinzer, Public Health Practice, developing a community innovation grant in response to increasing rural critical incidents in agricultural, mental health and well-being, community trauma, and natural disasters. Rachel Lynn Rutt, Epidemiology, a preliminary analysis of Project AgAware, SBIRT in agricultural work settings. Sharday Marie Sims, Health Promotion, developing a program evaluation plan for Medicaid prenatal care management programs. Samantha D. Wall, Health Promotion, equine facilitated psychotherapy program plan to reduce stress, anxiety, and depression symptoms for children in the foster care system in the Omaha metro area. Dunya Zaraya, Biostatistics, factors influencing the presence of a youth e-cigarette prevention program in schools and possible barriers to its implementation. Summer 2020 graduates. Israel Garcia Jr., Public Health Administration and Policy, Immigrant Legal Center COVID-19 Program Assessment Response. Josiane Cabeyundo, Epidemiology, Adolescent Alcohol Use, a comparison of rural and urban prevalence among students in 8th, 10th, and 12th grades in Nebraska. Mickey Chantel, Epidemiology, Structural Magnetic Resonance Imaging as a diagnostic biomarker of HIV-associated neurocognitive disorders. Spencer Lee Sterling, Epidemiology, Evaluation of the humoral immune response to patients hospitalized with SARS-CoV-2 infections. Congratulations to all of our graduates. And now I'd like to introduce Kelly Erickson, President of the College of Public Health's Alumni Council, to welcome our graduates as alumni.
I would like to share a few closing thoughts with our graduates. As you start out on this new beginning, I know that most of you are being bombarded with various emotions. Excitement along with fear, joy at your accomplishment, anxiety about getting a job, confusion about the best use of your recently acquired public health tools, and gratitude for this new education and skills. Let me share another emotion, hope. You now have new knowledge and additional skills to fundamentally transform not only your own life, but the lives in your communities. You are joining a proud and noble profession. There has never been a better time than now to be in public health and be an advocate for social justice and make a difference locally or on the global level. Remember how public health practitioners such as yourself transformed the 20th century. The world as we now know it would not exist if it were not for the great public health accomplishments of the last century. Right now, the world is in the midst of a pandemic, among many other illnesses. This is only one out of many examples why we need public health practitioners, such as yourself, to step out and make a difference. It is us, the alumni of the College of Public Health, that will seek and find the next set of solutions to tackle the public health challenges of the future. On behalf of the alumni of the University of Nebraska Medical Center College of Public Health, I congratulate you on completing your education and welcome you to this great profession.
Completing a graduate program is quite an accomplishment. As the students can attest, earning a graduate certificate or degree requires a tremendous amount of hard work, scholarly accomplishment, and a lot of persistence. All of our graduates were helped by others, including those who were viewing the ceremony, to share this special moment. We applaud you and thank you for your support and contributions to each of our graduates. I also want to thank the individuals who have assisted with making this special event happen. Greg Brown, Jessica Sharon, Eric Brab, Nicole Colum Valdivia, Michelle Beaver, Kelly Erickson, and Dean Kahn. Students, the good news is earning an advanced certificate or graduate degree in public health has opened a gateway that you will benefit from your entire career. There will always be forces of change in public health. In fact, we're right now experiencing a force of change with the COVID pandemic. As newly minted public health practitioners, you will be called on to develop new ways of thinking, being, and doing, and to meet the many challenges that we face today, as well as the unknown challenges we are sure to face tomorrow. To close today's ceremonies, I'd like to take this opportunity to say, on behalf of the faculty, staff, and administration at the University of Nebraska Medical Center and the College of Public Health, congratulations. We wish you amazing, transformative lives and adventures filled with inspiration, hard work, and joy. We look forward to hearing about all the great things you'll accomplish. Please join me in congratulating the University of Nebraska's Medical Center College of Public Health graduating class of Fall 2020.